everyone. Good afternoon for those who are joining us live here in the United States. If you're joining from another part of the world, good evening or good morning, as the case might be. My name is Gary Peener, and I currently serve as the director of the USC Price Center for Social Innovation. Today's webinar is titled, after our research project, Designing Data Platforms for Action and Influence, Lessons Learned from a Case Study of 5 Data Platforms. I'm pleased to be joined today by my colleague, Dr. Sheila Murphy, who served as a co-principal investigator on this project. And we're excited to get started on today's webinar to discuss the findings and then to also hear from you. Just a few housekeeping items as we begin. The webinar is going to begin with a research presentation by myself and Sheila, and it's going to be followed then by audience Q&A. And so what I'd like you to do, if you could, as you have questions, please type them in the Q&A box on your Zoom screen so that we can discuss them after the presentation. Before we jump into the research, however, I'm really excited to invite Octavia Vucek, who's the Senior Program Officer at the Robert Wood Johnson Foundation, to provide a few introductory remarks. Octavia?
Thank you, Gary. Good afternoon, good morning, good evening to everyone, and welcome. I think everyone on this webinar can agree that data is critical when it's used to inform decisions, shape policies, change how people think about the issues we care about. And I think the key piece of that is when it's used. We want to see data leaping out of spreadsheets and stats programs to inform policy and practice and to catalyze action towards health equity. That's why we're so excited to bring together experts in local data with experts in communications. We'll hear from the USC Price Center for Social Innovation and the USC Annenberg School for Communication and Journalism about what they've learned over the past year are the most successful ways to communicate complex data about the social determinants of health, so it shapes how we think about health and it drives action. We funded this work because, as much as we all love data, there are surprisingly few practical guidelines about how to effectively communicate about it. Some of the questions USC explored in their work included, what are journalists looking for when it comes to health data, and what ends up getting covered and how? What are the differences in how outlets of different political leanings are covering health data? What kinds of data visualizations are readers more likely to remember? And what kinds of data have an impact on social media? So we're grateful to the team at the Price Center and Annenberg for exploring this with us, and to the leaders from the 5 data platforms that USC profiled in order to come up with best practices. So a big shout out to those 5: Johns Hopkins Coronavirus Resource Center, University of Chicago COVID Atlas, City Health Dashboard, Neighborhood Data for Social Change, and the Opportunity Atlas. And with that, I'll turn it back over to Gary.
Thank you so much, Octavia, and thank you so much for Robert Wood Johnson's support for this project. Both Sheila and I absolutely concur with everything you just said with respect to data. Data is really is intended to lead to action. And to that end, we often don't know what is the missing piece between providing data to potential users and actual users, and then having a user base really develop. This project was truly interdisciplinary, and it was a great opportunity to collaborate between the Price Center for Social Innovation here in the Price School of Public Policy and the Annenberg School of Communication and Journalism. The team in Annenberg was led by Dr. Sheila Murphy, who is a professor of communication, and also worked with many colleagues there, and we'll mention Michelle Levender, who works on a variety of projects there as an adjunct professor, among many other roles in Annenberg. Our goal really, as Octavia highlighted, was to identify best practices for data platforms to inform policy, to inform practice, catalyze action toward health equity. By utilizing expertise from both communications and from public policy, the project consisted of a variety of different methods to provide a bigger picture of how users engage with data, to inform their work, and how users themselves actually make decisions about platforms. As Octavia said, we surveyed, and we saw that on the previous slide again, the 5 different platforms that we worked with on this project. Some of them emerged only recently because of the pandemic. Others have been functioning for a longer period of time. And others have goals that are directly related to health, and others that you would argue fall more into the social determinants of health. So when we're thinking about the methods that we employed on the next slide, we wanted to highlight the fact that we were, in some of the work that I'm going to talk about, we're focused mostly on in-depth semi-structured interviews with platform designers and platform users. In the work that Sheila's team led, she actually conducted focus groups with journalists who use data in their work. She did a content analysis of media mentions on each data platform, and as well as an experiment to inform how best practices and features of data platforms could be developed. So as we begin, one of the things that we found out as we interviewed the platform developers is that there was, in some ways, a different levels of engagement with stakeholders in very different stages of their development. And so we put on a spectrum, if you will, from dynamic engagement, which means that it was iterative and continues on an ongoing basis that's deliberate, versus static engagement, which often fell into the product design phase, but may or may not have been as active as kind of the time marched on. So in this way that we put these 5 data platforms on this continuum, where Opportunity Atlas fit a little bit more on the kind of the co-design early on engagement with stakeholders, and then relying more on the research and expertise as it moved forward, to the Neighborhood Data for Social Change platform, which is much more iterative as the work continues. But you can see along here that all engaged with users, engaged with stakeholders at important places in the development of their platforms. On the next slide, we want to talk a little bit about some of the findings from the research. So when we spoke with the data and experts and the users, what we found was that this kind of stakeholder engagement was actually critical. And the reason it was critical is, from users' perspective, was that data platforms were most effective when users actually understood why they're even looking at the data that they were looking at, what the data means, and then how that data can actually be used in their work. So for many people who might be looking at that data, they might be a nonprofit organization or a network of nonprofits focused on a particular issue, and they want to know how that data can be leveraged for change. Users expressed that additional features such as tutorials, trainings, webinars were very effective ways of building capacity to teach users how to use the platform to support their work. Additionally, users said that storytelling was an effective tool to demonstrate how the platform or data more generally could be used to support their work. And you can see this quote from one of our stakeholders at the COVID Atlas, and you can see there that their experience around story mapping was absolutely critical. When we talk about fulfilling data needs, again, interviewing stakeholders who are both designers and users, there were 3 features that emerged as most highly desired in a data platform. If you could provide data in as close to real time as possible, people put a high value on that, because their work oftentimes, especially in the context of the pandemic, was particularly shaped by knowing what was happening with case counts and hospitalizations within the community. But more generally, people are really interested in data from this year, not from 2 years ago. And as our data systems get better, being able to bring data transparently to users in a more real-time manner is absolutely essential when possible. People also noted that data disaggregated by subpopulation was absolutely critical, as well as data at a granular level from a geography standpoint. Why do we want disaggregated data population? Well, many of the users of these different platforms noted that they were particularly interested in issues of race, equity, and gender. And so unless data were actually presented in a way that they could learn what was happening across these different margins, they weren't sure how useful that information was in achieving some of their goals. issues around health equity were paramount to many of our stakeholders that we interviewed. Our findings with respect to data users, especially in the policy sectors and the health sectors, noted that they were increasingly wanting smaller and smaller levels of disaggregation within geography. In fact, being able to drill down to neighborhood levels was highly valued. And for many, many years, especially health data were often not available below county. And certainly some of the work by the Robert Wood Johnson Foundation and many other local groups have enabled us to bring this down. And you see exemplified in the quote here from a local government employee that this is exactly what they were struggling with, that even city level sometimes was not enough. Now I'd like to invite Sheila to present some of the findings from her team's work.
So we actually did focus groups with current platform users, some of whom were professional journalists, and I'm going to talk about their specific needs last. But in general, the current sort of lay users, I would call them, and journalists both requested. Some of the reasonable things they requested were as follows. There was a range of comfort, right, with using the platforms. And so some people wanted the in-person training that would be specifically tailored to the users or that organization's need. Whereas other people who are already comfortable wanted sort of self-guided tutorials readily available on the platform that they could just access anytime. And I think the difference between those two groups is comfort and experience with using those sort of tutorials. They also suggested something I had not considered, which was social media events or town halls run by the platform, showcasing the ways that their data could be used and has been used, and which might also serve as a networking function among disparate users of the platform. They wanted stories or narratives that demonstrate how the data can be leveraged to support the user's goals. And they mentioned that they really wanted to know that the platform was partnering with communities, the communities represented, to ensure that the narratives that were on a platform actually aligned with people's lived experience. And then they talked, both current users and journalists wanted, as Gary mentioned, data updated as frequently as possible, and specifically indicating the date of the last update. A lot of times the platforms did not say not only where the data had come from, but when it was last updated. And they wanted both of those pieces of information. And the data, as Gary also mentioned, the data that could be disaggregated by subpopulation shows up here as well from these focus groups. And what they meant by disaggregated really meant that they wanted to be able to run simple crosstabs of up to 3 demographic variables. And the most commonly mentioned demographic variables were race, gender, and income, for example. Particularly journalists wanted to be able to disaggregate it along those lines, just to give you a sense of what we're talking about when we're saying disaggregation. They wanted, again, data available at a more granular level, and by this, they either meant neighborhood or census tract or zip code. So those 3 levels. Finally, they really would have liked higher resolution visuals that could be easily downloaded directly into articles and reports. So, some of these were present on the platform, but they weren't easily downloadable to make them easier to use for users. So, next. All right, so now, in addition, journalists, we did separate interviews with both what we call journalists who were highly experienced with using data and more moderately experienced using data. We did focus groups with journalists from large national newspapers that you would recognize, and as well as from local rural areas. And so one of the things that they really hit home about throughout the focus groups was the issue of credibility. And by credibility, they meant the credibility of both the platform and the data, because as they pointed out, look, not only their personal reputation is at stake, but also their, their newspaper. And so, as this quote says, this site did not look credible to me at first. The lack of branding and a description as to the site's purpose, coupled with a .org address, makes me wonder who has put it together. Is it a nonprofit advocacy organization with an agenda? Again, they are very sensitive to issues of credibility. Who paid for this data, for example? And so the journalist suggested the following cues could be integrated into a data platform to make the data seem more, and the platform seem more credible. So association with a university was one of the things they looked for to get as a mark of credibility. Transparency around how the data was funded, and how it was collected, so sampling measures and things of that sort, intelligible definitions of variables, and more savvy data analysts really wanted to be able to download the raw data and to be able to do their own analysis. And they felt that a platform that allows us by providing raw data, that would be a sign of credibility that they stand behind the data that they themselves are presenting. Okay, next. So now I'm going to switch from the focus groups to a content analysis of how many times were any of the 5 platforms mentioned in print media. And what we did is a large-scale LexisNexis and critical mentions search of the calendar year 2020, and we located 506 print articles that mentioned one of the 5 key platforms. But interestingly, even though these are all data platforms, only a very small percentage, less than 20%, 18.6% of the 506 articles had graphics. Okay, even though they're data platforms. And this may be due to the lack of readily downloadable or available graphics. That, in other words, if you leave graphics up to the journalists, they may not have time, or they may not have the resources, unless they are with the New York Times or the Wash Post, who have their own data essentially center. Local journalists certainly don't have the time or the experience often to turn data into graphics. So of those 94 articles with graphics, another thing that I thought was interesting is that if you were more likely to have 2 graphics. If you had any graphics, they generally had 2, but they came from more affluent, shall we say, news outlets like the New York Times or the Washington Post. And I think this is an area that really could be worked on, because despite being cited in articles that featured one of the 5 key data platforms, very few, only 1 in 4, essentially use data derived from the platform that they mentioned. Which I think, again, if it had been readily available, graphics that could have been downloadable into stories, I think you might have seen that go up, which also, I believe, would have increased the citation rate for the platforms, right? Because if you have to download it, you could also mark it with your, your website, your URL, whatever. And of these 54 graphics that were used, based on platform data, not necessarily from the platform itself, but maybe mocked up by one of the news agencies, what types of graphic did they feature? Well, mainly they featured static maps, 25 of almost half, and that's probably because of COVID and the use of static maps to show COVID spread. But they also had line graphs, interactive maps, infographics and the lo and behold, the lowly bar graph. And I'm going to come back and sort of redeem the bar graph in our next in the next experiment. But essentially, what we wanted to know is, okay, static maps, for example, more complex graphics, are these the optimal way to convey information to readers or not? And so, to answer this question, we actually did a experiment on data visualization. So in this experiment, what we did is we had 915 adult male participants each read an almost identical COVID-related news article that we had written. And the 6 versions of the news article differed only with respect to whether the key fact, data fact, was absent or present in the actual text, as well as whether there was no graph, there was a simple bar graph, or there was a more complex graphic that actually conveyed this information. Now, importantly, all of what we're calling complex are not really complex, they're just more complex. For example, a static map graph would fall in that category of more complex graphics. And all of the graphics that we tested in this category of more complex graphics came from the Washington Post or the New York Times. So they weren't these odd presentations. So these 6 different conditions you can see now going across in that first row across. What you see here is that as you look across, the first 3 conditions all had the following sentence in them. While the initial surge of the pandemic last May was driven by cases among Americans ages 80 years and older, the current case count is largely driven by younger adults. Okay. Half of our sample, three of the conditions and half of the sample received that sentence, which means that the data, the specific fact of the actual age range could only be determined by looking at the graphics. Some people got the simple bar graph, and the correct answer is 18 to 24 years. And some people, this actually was from the Washington Post, I believe, and they could see this more clearly. Let me just say, you can see that the spike is driven by 18 to 24-year-olds. The other 3 conditions, we essentially aided that by inserting 18 to 24, you see it highlighted in yellow there, into the text. So in some ways they're getting it, but they could get that piece of information both by looking at the graphic or by reading it in the text. Okay, and as so I'll just show you an example of what another comparison between the simple bar graph and a more complex. This is a line graph. Here we have the bar graph versus the static map, both of which are supposed to be, and this is again from an actual news article, this is supposed to be pointing out that Michigan had the highest number of positivity tests coming back over the last week, and it was 20%. So you could, some people got the actual number of 20%, or some people got many more tests came back positive in Michigan over the last week, and that was either with the no graphic, with the bar graph, or with the more complex graphic. Okay, so I want to show you what then happened. What we did in this experiment is we let people read through this article at their own pace. And for more complex information, we know that reading is preferable to get people to remember key facts. And this chart, this bar chart, is actually showing, how many out of 4 key facts, each of which were accompanied by a simple bar graphic, a more complex graphic, or no graphic at all for some of our conditions. How did they do in these 6 different conditions? And the first thing that you should notice is that take a look at the green bars. All right, so what the green bars are on a scale that could be 0. You could have gotten 0 correct out of 4 of these key facts. For example, which age range was responsible for the most recent spike in COVID cases? The correct answer would have been 18 to 24, and 3 other questions like that. Essentially, this slide shows the average or mean number correct by condition, and one thing to note is that the solid bars, where the data was presented in the text, do better than the striped bars. Okay, so presenting, the first takeaway is it's better to present the data in the text, even over and above having any graphic. All right. Because you see here, the red bars are the absent graphic. So even absent any graphic, it's good to have the numeric data you're trying to convey embedded in the text as well. So secondly, the second important point is that simple bar graphics, the green, outperformed the other 2. Either not having any graphics, which isn't that surprising, but it also outperformed the more complex graphics. And here we're calling them more complex, but it's really simple things like line graphs or pie charts or the static map graphic that I just showed you a moment ago. And I think that the other thing that's really interesting about this study was that really the difference between the blue bars, which are, showing that involve showing the complex graphics, that actually doesn't do any better than the people who had no graphics at all. Okay, so the key finding is that presenting data in text with simple visualization is optimal, and that the simple data visualized in the simple graphic, like the bar chart, improves the reader's information processing and retention of key facts. And that's not surprising from the standpoint of information processing. We know that textually presented information allows people to process at their own pace. And we tend to think of ourselves when we think of the target audiences, and I think this is a mistake. We are all, from a general population standpoint, we are all way overeducated than the average person. And what is obvious to us, even from something like that fairly simple static map, may not be as obvious or as simple to understand as it is for us. And I think that that's one lesson learned here. And again, I think importantly, I think the inclusion of numeric data such as percentages or specific numbers of cases in the text of a news article enhances their processing and retention, but also the optimal combination is a simple graphic such as a bar chart with specific numbers in the text. So essentially you're getting 2 chances, 2 bites at the apple. They might get the information from the graphic, but if you had to choose one, I would go with including the numbers in the text. And again, the optimal thing to do is both. Okay, and I'm going to go back to Gary.
Thank you so much, Sheila. Again, let me invite our audience to put in any questions that you have into the chat function. We're about ready to turn it over to you. So we just wanted to kind of summarize our conclusions. Every one of these points has been made before today, but I think it's useful just to reflect on each one of them once again. So first, it's really important to clearly establish the platform's unique contributions. We are a world awash in data. And so for somebody who's just Googling data on a subject, they can arrive at so many different platforms in so many different contexts. And so it's important when they first approach a platform to know what is the unique contribution of this platform? What's the viewpoint? What are they trying to accomplish? A second point, as we had noted a couple of times, is to keep data as current as possible. And I know that this is a hard issue for data platform providers because it's more expensive to keep data as current as possible. For those of you who are data intermediaries, you are probably advocating to get data from data sources to make it as current as possible. We hope that our research will actually help inform those advocacy efforts. It's really important. It costs more, and so you'll have to face that trade-off. The third thing is that you do need to highlight your indicators of credibility. I think the research that Sheila's team pointed out was that people wanted to know that this was not just an advocacy, kind of funded sort of work, and that you were connected to a university affiliation. They could look at where the data sources were derived from, what was the methodology used. Those might be put on all auxiliary pages, maybe not the front page, but people did want to know that with their own credibility on the line, that these data were also credible. It's important to understand who your audience is. And to that end, we saw that the data platforms that engage their stakeholders or users more were able to curate data, more closely for those audiences. I do like what Sheila said in terms of the redemption of the bar chart. Next, we might see the bar graph. Next, it might be the redemption of the pie chart of all things. But I think importantly, what we saw here was that it is important to have information in the text to complement with very straightforward visualizations. If you want to get the information clearly to your audience, and also for people who are platform creators, if you want to get your visualizations used, that's what they're going to use. And people want to be able to download those simple graphics. And so that's something that is a feature that some platforms have and some don't. But hopefully this will encourage you to think about how you can enable your simple graphics in high resolution to be used more effectively. And then finally, we just like to note that one of the themes that came up in a variety of our interviews and focus groups and both of our teams at the Price Center and at Annenberg was that it's important that the communities, the broad communities that are going to be reflected in the data. And so that means questions of this question of disaggregation by race, ethnicity, income, gender, by county, city, neighborhood, census tract. These are really important ways for people to understand their data. And so when you're working with communities to actually inform the data, it will tell us what kind of data is going to be most useful in their efforts to pursue change that lead to greater health equity or other goals within their communities. So with that, I'm excited to open it up to the audience. And I think one of our team members is going to ask those questions for Sheila and myself.
Great. Thank you so much, Gary and Sheila. The first question we have is to Sheila about the data visualization. And an attendee asks, why were all participants in the data visualization experiment male?
Good question. Well, because we had to make a decision, and I have been doing a lot of work on COVID messaging. My life outside of this project it has, and even this involves some COVID messaging, but I've been doing a lot of work on COVID messaging. One of the clear differences early on was rumors about the fact that COVID would affect the fertility of females, and so some of the questions we were interested in had to do with how likely, after reading this article, how likely are you to go get a COVID vaccine? And so because of the heavy prevalence of this myth of COVID, vaccines causing fertility problems, which is a huge problem, we did not include females, and but we wanted to see if there was also some interesting ethnic differences. And so if you read the review, I can't remember if we included it in the review, but we did also have African American and European American men, and you had to be one of those two ethnicities. And we found no difference, interestingly. I thought that acceptance of the vaccine would differ by ethnicity, but it didn't. So I don't know that we made a big deal about it, but we couldn't have too many things varying, right, to do an experiment. So we chose to go with the ethnicity and male only.
Thank you. Our next question is from an attendee who asks, if you learned anything about how to encourage the public to engage with the organization hosting the practice or the platform, such as displaying a number to reach out to, an email, or a feedback session. Gary or Sheila?
Sure, I can say something on this topic and then turn it over to Sheila. I think if you look at the way that the typology of how the different platforms engaged with stakeholders, you saw that some were more dynamic and iterative and some were more static and sort of at the beginning. What we didn't do is to actually, to test whether a feature of a platform would lead to more engagement. But instead, what we saw across that typology is that those who had purposefully engaging with stakeholder groups through ongoing trainings, webinars, and actually, reconvening representatives of communities of users in addition to those who were, the data constructors and so forth, that those had more engagement on an ongoing basis. So the short answer is no, we didn't test whether the feedback button or those kinds of things were more or less important, but we did see that the platforms that had an engagement strategy on an ongoing basis tended to have better outcomes as it related to unsolicited feedback as well.
Yeah, we found exactly the same thing in the focus groups. Specifically, there was what initially I thought was an odd suggestion for social networking, town halls, and could they, see how other people are using the data. And I do think that that falls into that camp of people who have some investment in the data, have been to the site, and would like to see essentially have more interaction with other people who might be using the data. I think that fell into that category of things that could be done easily.
Wonderful, thank you. Do you have any examples of how the data has been used? And I'm assuming this means the data on the various platforms.
Yeah, there's two examples that come to mind. I'm sure there are many, many others, but we can start there. And then Sheila may also have some examples that emerged in the focus groups. And this is going to be, I'm sitting here at the University of Southern California, so I most know how groups are using data from these platforms in their local communities. So these are examples from Southern California. So one example was that there's a community group which is organized around Thai community development. And they were using these COVID dashboards, both the local ones, the neighborhood data for social change platform, and also some of the higher level ones to inform what the need was in their community. And so this was an example of there is a large concentration of the Thai population in central Los Angeles. And so they needed data in central Los Angeles vis-a-vis other places to know whether their community was more likely to be infected or more likely now to be getting vaccinated. And they actually used that to actually drive their policy in a real-time setting and advocate for more resources when they saw that there was higher infection rates in their community. So that's just one kind of short-term, like this year's example around COVID. Some of these platforms, though, are focusing on issues that are broader and kind of speak to opportunity over the long term. And so I know multiple groups here in Southern California that have really been focusing on neighborhood level rent burden, which is defined as the amount of income that's being used to pay the rent every month. And by focusing on those sort of metrics over time, they're able to assess whether policies around increasing affordable housing development or other kind of income supports for families are actually achieving their intended objectives. So those are two examples that immediately came to mind. Sheila, was there anything else from the focus groups that?
Well, actually, from the content analysis, I will say that when we look to see, how the platform data was being used, first of all, essentially, we should all be very grateful that certain credible mainly university-based. Here we had University of Chicago and Johns Hopkins COVID platforms stepped in, because essentially, and this is from personal knowledge, but also from interviews with the people who developed the Johns Hopkins COVID platform, it became very apparent very early on in the COVID pandemic that the government was not really invested in accurately tracking cases, right? The administration decided cases were a problem. They didn't want more cases. And so you had this real problem that I had never seen before in my life, having worked with the CDC, with NIH, everyone. All of a sudden, CDC, whose main purpose of being is to track disease, that's what they were developed for, not to prevent it. They were actually initially designed to track disease. They weren't doing it. And they weren't providing any sort of breakdown of who the COVID cases were, because it was largely in underserved populations who, exactly who you would think, people who couldn't afford not to go to work, right? So it became this real political football. Researchers who've been using these, weekly mortality reports from the CDC immediately recognized that something was terribly, terribly wrong. Johns Hopkins kind of stepped into the breach to such an extent that actually the government started, and almost all of the newspapers very quickly pivoted from the CDC data, which was either non-existent, slow, and an undercount, to very quickly pivoting to use the Johns Hopkins data. It became the data of record, because it was updated constantly. It was perceived as far more credible than the CDC, which is real. It's a testament to the Johns Hopkins data set and the University of Chicago as well. And later, other places picked up and did more granular data. But so yes, thank goodness we had them, and that they decided to act quickly.
Thank you. And I want to note that we have invited the folks who develop these platforms to participate in this webinar. And one of the folks from City Health Dashboard included a link in the chat, which shows how folks are using that data. So feel free to check that out. We have a good number of questions left, so I'll keep it moving. Would either of you like to speak to how data can be used for racial equity?
I think Sheila just gave a wonderful example of how data was used for racial equity, and I think it actually encourages me that there was such a quick pivot with these data platforms to note that, just knowing that there are cases is not enough, but we need to know not just that there are cases, but who in our populations are experiencing the risk and where. And so I think this was just, a very clear example of how equity objectives can be achieved because data speaks to, kind of exactly what's happening within communities broken out by race and ethnicity and also local areas. I think that's probably the best example in terms of what our research showed in 2020. But I'd just like to say one thing generally on this topic. I think that as we think about how to measure progress toward racial equity, I think everyone appreciates that we have to actually measure progress with data. And to that end, we need to understand what data we're using to measure that progress. And that speaks to what we learned in this project, which, I think many of us had hints at before, but you have to know where the data is coming from. When you're talking about race and ethnicity, the fact that the census, for instance, has moved to allowing people to identify themselves differently than in the past, with multiple racial or ethnic identities, and in other ways of identifying themselves. That helps us understand more how to measure progress toward a particular goal as it may relate to issues of health equity by subpopulation, as people are self-identifying themselves. So I think the work here really highlighted some great examples.
Thank you so much for that.
And let me just add on to
Sure.
Gary's point about the census. We similar to, as I said, that the CDC wasn't necessarily doing its best ever job of identifying cases. I think we need to all contemplate that the upcoming census numbers didn't go and beyond what they usually do, which is house to house. And in fact, they were shut down early. And the excuse being COVID, which may have been correct, but the fact of the matter is we should anticipate an undercount of hard to reach populations, minorities, etc.
Thank you for flagging that, Sheila. That is so critical right now. Let me pivot a little bit to this question. What components do you think contribute to creating effective visualization for data?
Again, I think, as I said, and I see this often in, sometimes I come up with a message and people say, well, isn't that a little low level or something like that? But I think as academics and as, all highly educated people, who I'm sure are the mainstay of this call, really, we are not our target audience. Okay, we are not our target audience. Remember that, and think, really keep checking back with your target audience to make sure they get it. Run focus group. If you do design graphics, again, I would veer towards simple graphics. Essentially, I would veer towards language that is, unfortunately, it keeps going down, but right now it's about the 4th grade level, literacy level for language. So, be careful what words you're using. If you're using a word that is unusual or, they might not understand, make sure to put in definitions of what you mean by representative, for example, a representative sample. What does that mean?
Yeah, nothing else to add there. I concur 100%.
Do you see a difference between how community groups or coalitions focus on catalyzing change, how they use data versus how media uses data?
Sheila, you may have a sense of the media side. I can speak there to the other.
That with this sort of constant news cycle, right? You see the ever greater demand for current data, right? And that is driven in some part by, I think, the media in part, I think that the community groups are not, I don't see that they are picking up with as much a need to have, the latest and greatest data, and they're not used to having that latest and greatest data. But I do think that we've all been spoiled by, dashboards that managed to do that during COVID, right? And now we expect it. And so I do think that it'll be interesting to see whether a data set that's 2 years old is perfectly acceptable in academics and for many community groups. I don't know if for journalists, though, I'm not sure that even general public or community groups are going to find that acceptable now. I think,
and I think
again, we may want to keep updating your data, again, citing when it was produced, right? Not just when it ended up on your website.
Yeah, I think it depends in part on what the community group's action orientation is, or the issue that they're focused on. So I think exactly as Sheila said, a lot of what community groups who have been working in particular neighborhoods or in regions for a long time, they want to know what's happened over time. They want to know not just what's happening right now or this year or last year, but they want to know how that compares to years, 5 years ago, 10 years ago. And so they can actually see the arc of change because they know what they've been doing and they know what other factors are happening within cities and communities and, counties, states, federal government that can influence what the change is. So there versus kind of like the real time might be much more important for instance, for community groups that are dealing with issues of exposure to toxins, pollutants, and so forth, where those sort of data, knowing, that students are exposed, like if you live next to a port, as some people in Southern California do, and there could be events where, exposure happens, they want to know how often and when that's happening so they can get that information back to the people that they serve. And so in some sense, the orientation, the issue area might demand more real-time data for action where others they've been working for decades. They want to know what's changed over time. Are we making progress? Is it incremental? Is it rapid? What can be done, over the next 5 years in their planning? So it just depends a little bit on the orientation.
Thank you. Another quick question related to data. As you looked at the various platforms, was there a difference in data across rural and urban areas?
Yes. And we had, when we did the focus groups with the rural reporters, it was one of them got very indignant and said, they never, all we hear about is, the big cities, right? I can only find data for the big cities, and it's not even at the county level, so they can't use it. And I had one very indignant rural journalist said, "We are not potted plants." I wasn't sure what exactly she wanted to do, but she absolutely wanted to point out that, many of the platforms do not have a lot of data specifically for rural. It's sort of like the big city and everybody else. But that there's a lot of area in that everybody else. And she was complaining that it was difficult for her to be able to, incorporate data that dealt directly to her readership because it just wasn't available.
Yeah. No, that makes sense. And I think one of these national platforms, really have to spread resources along various cities and regions, right? So it's a little different than our neighborhood data for social change platform at USC. So just 2 more questions. Of course, you can still add more into the Q&A if you have another burning question. This one's for Sheila, which is, was the experiment that you did repeated for articles with other topics? They say, I would not be surprised if more complex visualizations resulted in better retention for different topics, and just wonders if the experiment was able to be done for a different topic or only with COVID.
No, we just did it with COVID here because of, we had a timeline on this, both time and money constraints as usual. Would it have changed with, and we thought we wanted a topic that was of interest to everyone. And we ran this study last March. So essentially, certainly COVID was of interest to everyone. Rates were surging. And this was an article about variants and introducing variants and things like that. And so I think that it was a topic that sort of everyone had a vested interest in and processing at a certain level. So that's why we picked COVID, as well as my interest in COVID research. But I don't know. I think not. If I had to be a betting woman, I think not. I think I would find, we really did try to keep everything else very constant across the thing. And it was just very clear, not that, that the very simple charts worked the best with this population. They all had high school or above, but I'm thinking not.
Thank you. And this last one, I'm going to tweak it a little bit, and I'm going to ask you both to provide maybe a tip or two, or an example of how a platform can sort of measure their success or judge their own impact. So if you could sort of just, off the top of your head or from your research, provide one or two tips on how a platform could evaluate themselves or better themselves.
Yeah, I think that there's two things that come to mind. One is, I think you've heard it throughout the research that was presented here. Users matter. Every one of these platforms care deeply about the user's, experience, the fact that their data, all the work that was being put in was actually being used to address issues that they cared deeply about as platform designers, and what they were hearing their communities, their stakeholders cared about. So to that end, it makes sense to track how many users and for what purpose are those users using those data. The other thing that comes to mind in terms of thinking about kind of the effectiveness and how to evaluate success and so forth has to do with kind of these longer term issues around kind of how data is being used. And so are there opportunities for iterative re-engagement within the platforms? And so to that end, as we saw, there were different levels of iterative engagement. With that in mind, those different levels were over a single year, and it was a pandemic year. And so one has to appreciate that those, same platforms, same kind of approaches maybe have different in a 2019 or 18 setting. So those are two things that I saw as important in the work that we did.
And I would just add I agree with Gary, and I would just add that, if part of your mandate is to get the word out at a mass media level, you could easily do what a version of what we did, which is track how many media mentions you're getting. Is easy to do with fairly readily available LexisNexis for print. We used critical mentions for TV as well, which not only tells you where you've showed up, when it also can tell you who that audience was. It gives you a breakdown of the audience for this particular show in which this was included was, primarily women aged, 18 to 49, primarily, Mexican American, et cetera, et cetera, et cetera. So, it depends how specific you want to get, but you can certainly track your audience and see whether you're hitting the people that you think you're hitting, right? Which sometimes is you're not. You think you're putting it out there to the world, and in fact, you're hitting a very limited, or not even getting picked up nationally.
Well, thank you very much. I want to thank you again all for joining us today around this important topic. Thank you to Sheila and Gary and our project teams. And thank you to Robert Wood Johnson Foundation for supporting this work. We look forward to continuing the conversation. Please feel free to reach out to Gary, Sheila, or myself. You can find our email addresses at the USC website, and have a great day.